right, let's talk about a topic that can feel, a little daunting, oral tumors. But the goal here is simple. We're going to break it all down and give you a clear, straightforward guide to understanding what they are, and more importantly, what signs you should actually be paying attention to. So imagine this. You're just going about your day and you feel it. A little lump, maybe a bump, or a sore that just doesn't seem to want to go away. It is so natural for your mind to just jump to the worst case scenario. But what does finding something like that really mean? Let's get right into the facts. First things first, let's just get the definition straight. The word tumor sounds scary, but all it means is an abnormal growth of cells that forms a solid lesion, a lump or a swelling. You might also hear doctors call it a neoplasm, which is really just a fancy, broad term for any new, unusual growth. And this right here, this is probably the most critical distinction to make right off the bat. A tumor is not automatically cancer. Think of tumor as the big umbrella category. It can be benign, which means totally harmless, non-cancerous, or it could be premalignant or malignant. Cancer, on the other hand, is always malignant. Getting this difference is it's huge. So the crucial point, and hey, if you only remember one thing from this first part, make it this. Finding a tumor does not mean you have cancer. It's simply a sign from your body that something needs to be checked out by a professional. That's it. Okay, so with that in mind, let's shift gears and talk about the most powerful thing you can do, spotting the early signs. This is really where paying close attention to your own body becomes so important. And why is catching these things early such a big deal? Well, because when something is detected early, pretty much everything about the process gets simpler. Treatment is often way easier, any reconstruction that might be needed is less complex, and the overall prognosis is just significantly better. We're talking about catching it before it has a chance to spread, which, by the way, usually means the treatment is a lot less expensive, too. Now, I want you to keep this number in your head as we go through the next part. 2 weeks is a really key time frame for when something that seems minor becomes something you absolutely need to get checked out. Okay, so let's break down the things you might actually see. The biggest one, and the most common, is any kind of sore or ulcer that hasn't healed within that 2-week window we just talked about. Also, be on the lookout for any new white or red patches inside your mouth or a swelling that just pops up without any obvious reason, like an infection. A couple of less common but still important signs are a mass growing out of a tooth socket that hasn't healed, or even something like persistently watery eyes, which could signal a blockage. Now for the signs you might feel. This could be things like your teeth getting loose when you know it's not from gum disease, or maybe your dentures, which used to fit perfectly, suddenly feel off. That can happen if a growth is changing the shape of your jaw. Also, pay close attention to any new difficulty swallowing, or a feeling that your tongue can't move as freely as it used to, or any weird, persistent numbness in your lip or chin. All of these are clear signals that it's time to make that call. So, you've noticed something, and you've made the appointment. Good. What happens next? Let's walk through the diagnostic journey. The whole point here is to demystify the process and show you exactly what to expect. No surprises. It really all boils down to a pretty clear 3-step process. First step is the examination, where your doctor just gathers all the information. Step 2 is the diagnosis, which is all about figuring out exactly what's going on. And finally, step 3 is the planning, where a specific, tailored course of action is created just for you. During that first step, the examination, it's really a big conversation, a fact-finding mission. Your doctor will want to know everything. Your medical history, the nitty-gritty details of what you've noticed, even your daily habits. Then, they'll do a careful physical exam, and if they need a better look, they might order some additional tests. And these diagnostic aids, they're basically just different high-tech ways of seeing what's happening on the inside. A simple X-ray gives a great 2D view of your bones. A CT scan gives this incredible 3D image showing the exact size and spread of a lesion. An MRI is the go-to for getting a really good look at soft tissues. And a bone scan can light up any areas where there's a lot of activity, which could indicate a problem. Now, this highlights a really important methodical part of the whole process, something doctors call a golden rule. Before taking a tissue sample, they might use a tiny needle to draw out some fluid. It's a safety check, really. It helps them see if the lesion is filled with a lot of blood vessels, which helps prevent any unexpected bleeding. It's just a great example of how careful and precise this all is. If it's needed, the final definitive step to know what's going on is a biopsy. And that word can sound intimidating, but it just means a small piece of tissue is removed so it can be looked at under a microscope. If the spot is large, they might just take a tiny piece. That's called an incisional biopsy. If it's small, they might take the whole thing out. That's an excisional biopsy. And like we just talked about, sometimes all they need are a few cells drawn out with a thin needle. Okay, once a diagnosis is confirmed, we get to the final step, mapping out a treatment plan. This is all about understanding the specific, logical path forward that's based on what the science tells us. The treatment goals are completely tailored to the diagnosis. It's two different playbooks. For a benign lesion, the goal is pretty straightforward, complete removal. But for a malignant lesion, the strategy is much more comprehensive. The focus isn't just on removing the lesion itself, but also taking a small margin of healthy tissue around it, just to make sure no cells are left behind, and then dealing with any potential spread. So, after all of that, what does this all mean for you? Let's bring it all back home and talk about the power you have in your own oral health. This is all about empowerment through awareness. Ultimately, when you boil it all down, it comes to this. The single most powerful tool you have is your own awareness. That's it. Knowing what to look for, doing regular self-checks, and this is the most important part, making that call to your doctor or dentist the moment you notice anything unusual. Please don't wait. As we've seen, catching things early makes all the difference in the world. We've covered a ton of ground, from understanding the words to spotting the signs and knowing what to expect. So I'll leave you with a question to mull over. Now that you're armed with all this information, what's one small, simple step you can take this week to be a little more proactive about your oral health?